requesting Dr. Sankar Ganesh to explain little more about uvula and its relation to the air movement in the vocal tract. So that is very important. So he will now be able to explain that, and it will give a nice feedback for us, and it will be useful throughout the world. The importance of uvula he is going to explain with the audio visual presentation, and he has done it with good work on his computer.
ஸோ ஊலா அப்படின்ற அந்த உள் நாக்கை பற்றி எளிதாக சொல்லணும்னா மேலேருந்து தொங்கிட்டு இருக்கக்கூடிய ஒரு ஸ்ட்ரக்சர்னு கூட. ஸோ வாட் வி ஃபர்ஸ்ட் கெட் இன் டு ஊலா, எனி பர்சன் இஃப் யூ ஆர் ஆஸ்கிங் அபவுட் ஊலா, தே சே தேர் சம்திங் ஹேங்கிங் at the end portion of your mouth again. So what is ula? It's a palatine ula. It's a little piece, a teardrop. You call it as a teardrop. Teardrop like structure hangs from the upper portion of your soft palate. So then what are all the uses? It is located in the palate, soft palate, in the roof of the mouth. What is the main use of it? What does it look like? It resembles a punching bag. You can see a punching bag where there will be uniform thing. The punching bag will not be bigger in the lower aspect and very little in the upper aspect. It is a uniformed structure like a punching bag. And what are all the color? What is the real color? It is really pinkish in nature until unless it is infected or with some neurological deficits. Okay, then what is ula made up of? It is made up of a connective tissue, muscle fiber. It is also made up of a muscle fiber that makes the ula to hold in the center. There are several problems with the ula. You can easily divide into infectious and non-infectious. Easily we can classify. Infectious means you have tonsillitis, anything, there the ula becomes swollen. It may have some abscess in it, or it may get bigger. Non-infectious because of the neurological deficit. The neurological deficit, like the ula has to be in this place. This is normal. Where it goes and deviated to one direction. For some people it is basically right from their childhood, and most of the people it is due to a neurological deficit. What is the ula stimulation? We have taken 4 patients who have got ula deviation. In this ula deviation, they are with the same age group. They are all with the same neurological deficits. 3 with a cerebrovascular accident, you call it as a stroke, and 1 with a head injury condition. We have treated them using ula stimulation. How? Basically with your hands. You don't want to have a special, we don't even have the mouth opener device in this. We basically treated with a simple stimulation with a mere non-electrical, just movements of your side aspect of your ula, out of which number of in just 13 to 14 sittings, 3 of them got their voice back. Further continued with the laryngeal stimulation. This is what I am showing you earlier. This is a client. When you ask to speak, you know what he will do. Maximum sound he could generate is this. That's all. Not even that rough voice. But after the stimulation, this is his real voice. You can hear. So he has got that voice, that he was struggling even to speak. He is trying to modulate his voice because all of a sudden he got that back. So this every part of the mouth needs to be taken care. Every part of the voice needs to be taken care. But what we do is we don't understand what is there inside. As doctor told earlier, while kulangal potu, you put some stones in your mouth and stand in the water, that too with the level of abdomen. Why? They have mentioned this. கழுத்தளவு தண்ணீரில் நின்று குரல் வளை பயிற்சி செய். கழுத்தளவு, why you want to stand in that water? Because the water pressure will crush your lungs. You have to breathe effectively to overcome that pressure, and after that if you are going to shout, automatically this generates an extraordinary voice exercises. This can be modified with several compression techniques. There are several researches going on. They would compress your body and ask you to speak, ask you to breathe. This is practiced with the divers, this is practiced with aeronautical engineers. They'll be put into a compression bag and they'll be asked to speak effectively. So they have to overcome the lung pressure, atmospheric pressure to speak. These type of researches are going on. So hula plays a major role in treating your voice. That we have come to a conclusion. And how we are going to so by stimulating the hula, that particular person was able to speak. So laryngeal stimulation and hula stimulation plays a major role in bringing back your voice. Okay. Further studies, what we are planning is, we are going to collect patient data and collect people who have got removed this hula. Hulaectomy. Hulaectomy people needs to be studied with their resonance, force and voice. That is what our future studies are. In the next episodes, we'll go with the future studies. Thanks.
I want to tell few things, brother, because you have told the hula manipulation will treat them. Say, Shankar Ganesh, I am requesting you to do your research. Few people not able to hear, they are not talking. We say that because of loss of hearing, they are not able to talk. They are intelligent. They are very intelligent. They are studying BA, MA, everything. They are working in canteen, receptionist, everything. Why not you try that people, those who are not able to talk? I personally feel if you stimulate the hula, they may get the voice.
Sure,
why not,
we'll try with
why not you try? Because this is if you try and succeed, you will get Nobel Prize. Because lot of people are there.
Yes.
They are not. You are initiated. You have done it. Dr. Krishna was telling me for a long time, why not I use electrode to stimulate the hula? Because you are doing it already for a paralysis people, tongue stimulation with a minimal current. That current you get into your tongue.
Yes.
With
my own finger. Electrodes are my own finger.
You spoil your own finger and stimulate it. So why not you try that? We may get it. And similar to that, shouting. Many people got good voice. Even Arnaharinadar, he voice only because of God had written in his tongue. Similarly, lot of
tongue stimulation, science.
Tongue stimulation.
The tongue stimulation directly done by God into his tongue.
So many histories there. So that's what I am going on repeatedly telling. 63 Nayamar, 18 Siddhargal, and 12 Alvargas. See, can we able to get these people in foreign countries? So our culture is great. I pray God that you should try with the people who are not talking. I am not telling the people with brain damage. Now you
normal
people not able to talk because they say the theory is they are not able to hear. Why not you break it? Shankar Ganesh hand, break it. Thank you. Great. We will meet.